Hi, I'm Hilary Talbot, acupuncture physician and clinical herbalist. Today we will be discussing Achilles tendonitis and the use of acupressure to relieve symptoms. Achilles tendonitis is actually inflammation of the Achilles tendon, go figure, here on the ankle. And that tendon actually hooks into the heel bone and comes up this way. So a lot of times you'll have pain here, and then sometimes actually it'll refer down and you'll have a little bit of heel pain. And if it's really inflamed, you might actually even begin to have like a bump there or some redness. So some local points that you can stimulate are bladder 60 and kidney 3. Now they are both located behind the malleolus. So lateral malleolus, bladder 60, is right here in this little indentation. Kidney 3 is also located just on the other side of the ankle and the indentation between the medial malleolus. So you can grab both points and stimulate them at the same time. Now what this does is this helps with circulation. So if there's an acute inflammation and this isn't too painful, this could be really helpful. If this is really inflamed, let's say that you ran on it, which Achilles tendonitis definitely tends to be from overuse, so I always try and tell people give yourself a break, take a couple weeks off of any intense exercise or being on your feet for long periods of time. I might use gallbladder 34. Now gallbladder 34, see, I'm going to start in the gallbladder meridian and I'm going to come up the side of the leg just before the knee where the fibula head tends to curve. There's actually a little indentation right in here, and a lot of times it'll be really tender if you're experiencing any tendon or ligament issues. And this point is actually helpful in treating the tendons and ligaments of the entire body, and also helps with production of synovial fluid in the joints. So if this is too tender to touch on this point, you may touch the gallbladder 34 instead, or if you've only got inflammation on one side, you might actually treat the channels on the other side. The channels are bilateral and they actually circle together. So don't think that you have to treat the side that the pain is at. It's actually kind of a strange thing when you go to an acupuncture physician. The patient all the time will say, but my pain's on the other side. If it's too inflamed or too deficient, we might actually choose to treat the channels on the other side. So give that a try as well. I encourage you to seek out your local acupuncture physician to make sure that your diagnosis of Achilles tendonitis is correct, and also so that you can receive acupuncture to help with the symptoms of the Achilles tendonitis and to get exercises that you can do to strengthen that area of the body. I'm Hilary Talbot, and that was acupressure for Achilles tendonitis.